Health reform critics have put the president on the defense, battling back against those nasty rumors that have spread like wildfire. But he'd rather stay on the offense, pushing his plan to make sure people with pre-existing conditions, for instance, get access to insurance they can afford. It's time to get real on health care reform. Alicia Knight is a Washington, D.C. area mother of two. She works for a nonprofit and struggles to pay for her family's health insurance. Alicia, good to see you today.
Hi, Contessa. How are you?
I'm good. I'm good. Listen, tell me your story, because I know that at one time you were on your husband's health insurance and everything was hunky-dory.
Yeah. He worked for a small contracting firm in Washington, D.C. He was also getting, changed around with healthcare all the time, year to year. He would have we'd have to change doctors, but then he died in 2004, and we had no health insurance.
So I understand.
We had COBRA benefits.
Okay, so you were offered up COBRA after your husband suddenly passed away. Could you afford those premiums?
No, COBRA was actually very expensive, and in order to economize, I mean, we're on for a couple months. In order to economize, I went looking for other health care in the individual insurance market, and I was able to find coverage with an HMO, and I was able to insure my family sort of affordably with the HMO for about a little bit less than what the COBRA benefits cost.
And you wrote to me that that there have been times now, because of some issues with asthma with your children, which are considered pre-existing conditions or whatever, that in order to get the insurance, you were paying more than your mortgage payment.
Well, it was the asthma that was a pre-existing condition, and then also as I got older, when I turned 50, I was looking at a premium for health insurance that was going to exceed my mortgage payment. So I did some more changing, and I took my children off of my insurance and put them on a separate policy and kept the policy for myself, and that brought my coverage down to a more affordable rate, although I was spending quite a bit more.
Okay, so Alicia, have you ever skipped what doctors had advised you to get for yourself or your kids in terms of preventive treatment, medical treatment, because of the cost?
Yes, absolutely. I will tell you that when you have insurance in the private market, it is something that you sort of hate to use, because every time you go to the doctor, you have to justify that doctor visit when you go through underwriting again. And also you're afraid if you do go to the doctor and they find something wrong with you, then you're going to end up losing your insurance altogether, or they will increase your insurance rate to the point that it's just unaffordable. So yes, there have been. My son, who's 16, he's had a sore throat. He wanted to go to the doctor, and I said, honey, we really need to make sure that when we go to the doctor that it's for a good reason, and don't go to the doctor just because your throat is sore. Yeah. Maybe wait till you have a fever. and I don't know, I crack all the time. There's all these tests that you're supposed to get when you turn 50, and I said, why have the mammogram if you can't afford the cancer?
I think that there are a lot of parents in the same boat that you are, working hard to pay for this. I want to mention that you worked for Senator Wyden back in 1992, a long time ago, but now there's a lot of focus being paid to his ideas for health care reform, having to do with employers, if they offer insurance, actually paying a voucher or whatever for you to go and pick an insurance, that the vouchers would work in a way that allows people with employment. And if you don't have employment insurance, the government would offer some sort of voucher for people who make less than a certain amount of money. Do you think that there is anything that you've heard in any of the plans, either from your former employer, Ron Wyden, or others, that would help you buy insurance to make sure that when your son asks to go to the doctor, you feel like that's doable?
Well, Ron Wyden is probably one of the smartest guys in Congress, and he's been working on health insurance and health care for as long as I've known him, and I've known him since the early 80s. And I really think that he's come up with an interesting plan. I'm not sure that without a public option that it would be helpful. What I do like about some of the plans I've been looking into are the consumer protections. That absolutely has to be done. Anybody who has a pre-existing condition right now, they are you know, they're at loose ends. I have a friend who's in his 50s. He's got asthma. He can't get insurance anywhere at any price. I have my boss. She and her husband both have chronic illnesses, and their insurance. I mean, I really can't feel sorry for myself. I pay a lot of money, but they pay about 3 times what I pay.
Wow, I know.
And you know, so there does need to be more consumer protection. There does need to be some form of public plan that will help the competitive market, because the insurance market itself right now is not that competitive.
Alicia, I so appreciate you coming in and sharing your story. I want to mention that you and I actually touched base on Facebook, and so I just want to let people know again, I'm very serious about getting real on this and talking to, look, I want to talk to the experts, I want to talk to the lawmakers, but Alicia is among those of you out there who have real stories to share. So find me on Twitter. It's pretty easy. Go to twitter.msnbc.com and you can find me there. Get me on Facebook and let me know what you're going through. And Alicia, I appreciate you so much for sharing your current situation.
Well, thank you so much, Contessa. It's been delightful being here with you today.
All right. We'll be right back.